My name is Randy Kardon. I have an MD and a PhD, and I'm a professor of ophthalmology and director of the Neuro-Ophthalmology Clinic at the University of Iowa in Iowa City and the Veterans Administration Hospital in Iowa City. I'm also the director of a newly awarded Center of Excellence for the Prevention and Treatment of Visual Loss at from the Department of Veteran Affairs, and so our center is in Iowa City as well. I had a DOD grant that's in its third year, and I've also just been awarded a new DOD grant for this coming year. And so I'll give a little brief summary of each of them and how they affect soldiers in the battlefield and after exiting the battlefield. The first grant was in conjunction with Dr. Sinisa Grozdanek. He's a veterinary ophthalmologist at Iowa State University, our sister institution. He's also part of our center. And that grant was to study the effect of laser injury to the retina and new ways of treating it with neurotrophic growth factors injected into the eye. So this was geared towards battlefield injuries due to laser. This is a growing, increasing problem, both from accidental injury because of laser-guided missiles, and also because in the newer battlefields, expected that enemy warfare is going to include laser damage to soldiers. And so this was a grant that was geared towards addressing that need. And it was performed in dogs, and we showed that with the correct selection of the right neurotrophic growth factor, depending on the receptor presence in the eye, we were able to retard the collateral damage due to the laser injuries. So I think this was a grant that was written towards a growing problem in the military arena that's well recognized in military circles. The second grant, which was just funded, has to do with new objective methods of testing visual function in cognitively impaired individuals. And this is geared towards soldiers who have undergone traumatic brain injury. And these soldiers, some of them are cognitively impaired, and so they cannot perform normal visual function tasks, and it's difficult to test to assess what their visual function is. So this grant was geared towards developing new objective techniques of testing vision in this group of soldiers and veterans, and also has application to other patients that have cognitive impairment from other types of traumatic brain injury, from dementia, from Alzheimer's disease, and also is applicable to infants who can't communicate well. And this uses techniques such as the pupillary light reflex and eye movement to moving targets changing in resolution, and also evoke potentials from the retina and the brain to draw objective to measure visual function. And so this has a lot of application to a growing need for methods of assessing vision in traumatic brain injury and people who can't cooperate that well with visual field testing. Regarding the advice that I'd like to convey to other researchers, both new to the field or experienced in applying for DOD grants, I would say this is a little bit different from other funding agencies. To some extent, the people who are advocating for federal funding in the DOD, they are very responsible to Congress to showing the fruits of the research and the labor. And so this is a moving target. The more results that we show that can positively impact on this group of patients and soldiers, the more impact this will have in the future on getting more funding. And so the reason I say that is that as a researcher, one should try to focus one's purpose and objectives and outcomes on projects that they really feel they can deliver on, that will have an immediate impact in this group of patients and soldiers that the DOD is trying to address. This will help not only your cause, but also future researchers in terms of obtaining money in the next fiscal year. So I would say it's very important to think about your ideas in terms of showing that this will have an almost immediate translational impact in the very near future on the problem you're trying to solve. This would be one of the best advice I can give. Also, the needs of the DOD are usually well thought out and well focused in the request for application. And so rather than trying to reapply what you may already be doing to a problem that they want to solve, it will be much better to really directly address and focus your area of research on the need that's being conveyed in the request for application. So in summary, I would focus my problem on the need and also try to realize that fulfilling the objectives of your research project that you propose should have an immediate application to the DOD's needs. And if there's a treatment component involved, I think that is also extremely high priority for the DOD.